Hi, everybody. Welcome to the AI Revolution podcast with a new episode with Yudara, founder of HeHealth, and a new tool we're very excited to talk about as well later in the show. Welcome to the show, Yudara. Thanks for coming on.
Thanks, Jacob. Thanks, Spencer. I'm really excited to talk to you guys and then looking forward.
Awesome. Well, let's start with just getting a little quick background on you, Yudara. What brought you to the AI space? What's your AI upbringing? How'd you get here?
Yep. I'll give you a quick update. By profession, I'm a consultant emergency physician, ER doctor, basically. Been practicing for almost 15 years. That's the boring part. The fun part is I start coding when I was about 9 years and in languages which a lot of youngsters don't know even nowadays. From QBasic, I write a small game with QBasic, which I carried in a diskette. And a lot of people don't know what diskette is these days. But that engineering passion continued to grow alone with my education. And when I did my higher studies, I did really good grades and I got a good position in the medical school. So I went to medical school, but on the side, I continued to code. And of course, my engineering career continued to grow about 6-7 years ago when the AI was a thing. So I picked up AI from technology. I slowly moved to AI and then I continued to innovate. After being graduating as a doctor and a physician, and then I have engineering background. So I was one of the very unique people who had engineering hat and a medical hat on the same head. So with that, I was involved with some of the university teaching in NUS, which is National University of Singapore, where I do practice as a physician last time. So basically that's my upbringing on the AI side. Now, of course, 2 years ago, I co-founded HeHealth and then moved to San Francisco, where I based it.
Nice. Yeah, it's a very unique background. We've not talked to anyone yet who's both a doctor and an engineer. So that's.
No, I feel like you're exciting. Some kind of superhero. This is awesome. This is great.
And that's exactly what I write in my LinkedIn introduction. If you have read, a lot of people tell me same because on the out of doctors also I'm a ER physician. ER physicians usually come into a lot of people's life when they're at the lowest place, like when they have the very bad experience, like accident, heart attack, stroke. When you come to that place, usually it's like the superhero comes. So a lot of people, and then I write my intro as I'm not the superhero where I came, but I do a lot of similar things, yes. Even in HeHealth, sexual health, something so personal. When people get STI, it's like literally the lowest point of their life, like, oh my God, how am I going to face the society and so on and so forth. So I create technology in that space and then helping people. That's honestly a big deal. I think, work is very related to superhero, but just without the cape.
Exactly.
So what was like the kind of the idea behind HeHealth originally? What inspired you to create it?
Yeah, actually, as I said, I was involved with innovations in my academic career in the hospital and I teach in university, so both. And I do a lot of projects on the ground, so it is very familiar. But there was a turning point. Two things. One is one of my friend almost killed himself, suicide, because of a misinformation, thinking that he had HIV. I'll give you the quick story. He's a married guy. He had a very big party. Next day, he wake up naked on the bed with another naked lady. So he completely freaked out. He couldn't remember anything from the night. So he assumed that he must have had sex with this unknown person. He immediately chased her out and then went to shower. And then he saw some rash on the penis. And he was so freaked out, he started Googling. And the impression he got, the information he triangulated is that he have HIV. It sounds ridiculous, but he got so depressed on this at some point because he's a married guy. He couldn't tell his wife clearly, and he don't know how to ask help. And then he was suffering with this. And then at some point he said the best way to reduce his suffering is to kill himself. It sounds ridiculous, but that's what he tried to do. He sent me a message on that particular day saying that thanks for being a good friend. Me as an emergency physician, I have seen this in suicide notes. So I immediately rushed and I was so right. He was in a balcony of an 8th floor about to jump. Anyway, I get to examine his penis as a physician and realize there's nothing wrong. It's all in his mind. And then there was no way guys can get help in a personal manner than Google. The best alternative is Google, which is rubbish.
Wow.
And we know Google algorithm works in a way, it gives most profound answers, which is when you say a cancer, people freaked out, it gives you cancer as answer. And then in this case, the worst is HIV, it gives you HIV. So that was stuck in my mind. I was thinking about it. I told my co-founder about it. And then same time, this is 2019 Christmas. And of course, what happened in 2019 Christmas, there comes COVID. And then also I was leading COVID part in my hospital in the emergency department. And I still saw there were two young men came. Oh, they didn't even make to the hospital. They were dead. We had to bring the dead body to the hospital, which was shocking to me. Singapore had one of the best healthcare systems, but they didn't know that they had COVID. They died at home. So there's a gap where you have the best diagnostic test in the hospital, which is centralized, but people are dying at home. And my friend had the same thing. He didn't have information at his at home, and then things are there in the hospital. So there's a gap. So that clearly shows me that there's a gap for something called decentralized testing. And then nowadays people are digital creatures. They live in the phone, everything. Youngsters, the first thing they do is everything goes to the mobile. So I was thinking like there's a very new space called digital diagnostics, create digital tests through the phone. And then I thought, okay, that's a good place to start. And then I was very passionate about sexual health to start with. My co-founders, they are also very passionate. And then we were talking about it. During the COVID, we had a lot of time, like think about it and so on and so forth. We started doing some data and then build a small model that went viral in Singapore. And then after 2 years, I said, okay, this is good enough for me to quit my full-time job and start something, because we were already quite passionate and we were the only people on the world to do such things. So it was very cool.
Yeah.
So 2022, I jumped out of my academia in hospital and university, gave up everything, started HeHealth.
Wow.
That's a really, really cool story. Because I've heard similar stories from friends, who get really stressed out about a perceived health problem, and then they go to the doctor, and that health problem is either not as severe as what they thought it was, or it literally just isn't a problem. Yeah, so I think it's an inspiring story to empower people like that.
It is, Spencer. And also in the sexual health, the problem gets even more significant, because when you think that you have something, usually people will rush to hospital. But in sexual health, this is so personal. I have heard many times, 100 times, I just don't want to go to doctor to drop my pants down. So you have a problem and you don't want to go to hospital. So that misinformation and wrong ideas are growing inside your brain. So that's why we thought this is a really big place we can innovate. And of course, STIs are infectious diseases. And I thought we saw the impact of COVID around the world. And what if the next pandemic comes from STI? And we were almost right. Monkeypox came very close. And that's why we thought, okay, this is a really good place for me to start. And then I saw the impact. And that's why everybody was like so convinced that STI is a very good place. But our bigger mission and vision is very clear: infectious disease as a whole and all the other diseases. Now AI is so powerful. I believe at some point, more than half of the diseases should be able to diagnose from the phone without a doctor or blood test or chest x-ray, that kind of situation.
Yeah, I have been so fascinated with artificial intelligence in the healthcare, in the health space. I just think it's going to it's going to personalize everything. It's going to make it so much less of an assembly line. Like, you come in, here's what we do. Like, tell us exactly what's wrong, ask pointed questions, and like funnel down to the actual problem. So that's, if I understand right, that's what you're saying is your real mission here. Is it's not just STIs. It's to provide a digital diagnostic tool. Is that right?
Yes, digital diagnostic is the final goal, but to go there, we have to pass many hurdles. As I said, this is a very new area, only very few companies or startups or people working on this. So we started with something called digital screening. So that's a precursor to the diagnostics. You still have to confirm it. And then, of course, at some point when the technology grows, your screening becomes the diagnosis itself. And I can give you an example. Some of the HPV viral wart screening actually is so close to PCR gold standard, about 98%. And then it's good as a diagnostic test. But of course, that needs to go through FDA to get the official confirmation, so on and so forth. So theoretically speaking, it'll take some time, but this is exactly what you're looking at. You're correct. Yes. And of course, it's definitely more than penis pictures. In jokingly, we say dick pics. It's definitely more than that. But yeah, that's the mission.
Yeah. So what does the process look like for someone?
Yeah, HeHealth, it's very simple. We envision it to be very simple. In the early stage, what we did is you answer a few questions, upload a picture. In this case, it's a affected area of your penis, and then AI will analyze and then give you possible screening results. If there's any visually recognizable STI, for example, was worst commonest STI is HPV. And then other things like herpes or syphilis, which can be obviously seen when they are symptomatic, those things can be analyzed and say, look, I think you might be having syphilis, for example. That's what we started with. But now our technology has grown also. And these vision models are completely proprietary. We build the technology, we build the data, everything is here. Now that the LLM came in, we actually combine these two with the very powerful solutions. Now you can actually go through the first part as it is, and then after that, the LLM will pick it up and say, hey, don't worry, I think you might have syphilis, but we can guide you through. This is how it is. This is the treatment looks like. This is what you need to do. And then, of course, as I said, we moved to California, and all the doctors are onboarded into the system. And then the LLM, it's called Otis, and Otis will come and say, here's the doctor. You can just book a clinic visit. They will help you out during the clinic, and after the clinic, Otis can come in and guide you through. So it's a very comprehensive ecosystem we have built, which is available in California at the moment, but we are going to expand to other states.
I really like that because that lowers a lot of the barriers, right? Because it's like there's multiple barriers. First, to believing that you might have an STI. There's a lot of people out there who want to never believe that that's the case. And then second, for making it easier to then kind of take the initiative and schedule an appointment with a doctor. Then once people have an STI, like there's a lot of people who aren't going to want to admit it to anybody else. And so I think that's a powerful way of approaching it, of building essentially a road to the doctor's office for the affected person. I like that a lot.
Yeah, Spencer, you got it exactly right. These are what we call entry barriers. So there are many entry barriers until the patient makes to the doctor. And what we do is removing these entry barriers, make the process as smooth as possible. And now we know, because youngsters are the Gen Zs are the ones who are exploring the sex at this point, coming into the scene. So they are digital creatures. They want everything to be digital, like click, 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 or swipe, swipe, swipe. So we make that process in this journey so that it's simple as click, 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 click. Oh, I'm actually at the doctor already. So that removes the brain power for them to think and act. So those are called entry barriers. So we thought and really put a lot of effort for behavioral science point of view with my co-founder to remove these things in a digital process, so that without even realizing, oh, I'm at the doctor. So, that's our mission. Yeah. So you got it exactly right.
Yeah. And I also love the thought that went into, I feel like so many products only get you part of the way there. Like now you have Otis, right, is what you said, where you almost have this guide to hold your hand. Now through the process, it's not just like, okay, you have a problem, now go figure it out. It's you've provided a full end-to-end solution of like, let's figure out the problem. Now let's walk you through how to get there, which I think is powerful in any industry, and I think is often lacking. So the fact that it's starting with like personal health, I think that's so powerful. I think that's great.
Yeah. I think that's one of the, of course, when you first started, as I said, it was just, it gives you a say, oh, you might be having syphilis, but we didn't have the technology to guide them through. But now it's so, and I'll give you an example. There was this one person come back to and said, of course, now it's a paid service, right? Of course, we price it super low compared to when you visit a doctor. It's $10. But one person came and just paid the $10 and sent a note and said, thank you so much. We were like, why you paid $10 to say thank you? He was, of course, I sent a note in the email and said, you can actually, I want to know why you paid to just say thank you, He said, this is so amazing. Not only that you helped me to pick the disease up, I was so happy. And then when I actually, after the doctor, I had so many questions, like, okay, I had an ulcer and I'm taking antibiotics. Why on the second day it's not better? And I use your technology and it says actually it's better than the previous one. So that, I actually say, it's working. And then I actually used this 2 days later, and then I realized the AI couldn't pick it up anything. Then I was convinced that it's actually getting better. It's healed.
Oh, wow.
And then I asked the OTs, can I have sex now safely? And because these are the questions people don't think when they go to the doctor, because acute problem is not there. But after a few days, then they realize, like, okay, I think better, but to be on the safe side. And he said it was not strong enough for me to go and to pay $200 to the doctor again, providing that I can get an appointment in the first place, which is very difficult. But then Otis was there. I asked him, and AI said, I cannot see the wound at all. And then combined, it says, it looks like you are very safe to have sex now. And he felt very happy about it. That's why he paid another $10 to just come back and say thank you.
Wow.
Yeah.
I love that.
I mean, these are small things. Honestly, I didn't see also it coming, Like when we envisioned, we didn't see the impact it's creating, but this is actually the impact it created. People felt really happy about it, Otherwise, these small things might be stressing them, over and over again.
Like they go to, WebMD, like you were mentioning earlier, like most likely they're going to come up with the wrong answer, because humans are really good at convincing themselves that something much worse is going on than is actually going on.
The worst case scenario. Yeah.
Yeah.
So, Yudara, how big is the team at HeHealth right now?
At the moment, the full primary team and then supporting team, all about 15 people.
Okay.
Yeah. So we have about 10 full-timers and then a few people supporting as outsiders and contract.
So how many of those people are health industry experienced in some way, and how many are, more engineer side or sales or whatnot?
I think it's a good balance at the moment. So one of the most important things I'm very proud of our team is we are a very diverse team. When we first started, it's a subcontinent Asian background, brown skin guy, straight, and a Chinese girl, plus a gay man. So we had a really good combination on the starting point. And then next person to join is our CTO, who's a white Caucasian male. So, and then now it's within this 15, we have all the different aspects of sexual orientation, different variations of skin color, and 4 religions, including Muslims. You'll be quite surprised. We run a sexual health. A lot of people say, oh, this definitely will not fit into Muslim. No, actually, we have Muslims in the team. And we are very diverse. 50% is females. And you will imagine we are running a penis app and then should be a lot of guys. No, actually, half of the team is females. And of course, the question, we have a balance of, I think engineering is definitely overpowered, more engineers. But we have 2 doctors, including me, and 1 researcher, scientist, and my co-founder Mailing is from the pharma side. So yeah, it's a mix.
Awesome. That's sweet. Jake, did you have a question?
I was just going to ask, I know, Yudara, before we started the episode, you mentioned that there's been you mentioned like how 50% of the team is females, which is amazing, by the way, and I think so awesome. But you had mentioned that a lot of females were getting interested in like diagnosing their male partner sort of thing, helping them use this, which has now led to kind of a new product, right? Can you tell us a little bit about that?
Yeah. Actually, this product is being led by my co-founder Mailing, and surprisingly, from the day we started, we get a lot of messages saying that we are using HeHealth for my partner or my boyfriend or so on and so forth. And they were asking from Mailing, can you just give us a brand name? Sorry, different brand with our female feeling, because HeHealth is quite masculine in nature. It looks like an actual guy thing, but we want to have our own thing. So, but the trigger point was the story, what we call Stacy's story. Of course, not the actual name. So there's this 19-year-old girl one day stormed to our office and said, record my story. I want everyone to hear this story. We were like, whoa, what's going on? Like HeHealth is meant for guys, he said, yes, that's why I want you to record this story so that everybody knows it. Anyway, she was saying, I'm a very scientific person, and my whole life I was not rushing to have sex. I was waiting for my right time. I met this guy in dating app. We dated for 6 months. And then at some point, of course, I felt he might be the right person. And we decided to have sex, and we plan it instead of having a quick decision. We plan it, and I bring my own condoms. And when we were about to, we discussed about STI testing, but he said it's his first time, it's my first time, so there was no need. But when we were about to have sex, I noticed a rash on the boy's penis. And I was like, wait, I'm not a penis expert. I'm seeing penis for the first time. I might be freaking out, but what is this? He was like, oh, this is summer. It sweats a lot. And then it's just a heat bubble. And she said, look, there was nothing for me to mistrust. And there was nothing for me to initiate a conversation. Like I'm a 19-year-old girl. What do I know about penis again? So they go ahead and had sex. But few days later, she got the same rash. Then she freaked out. Look, I never had this kind of thing. And her best friend used to intern at my startup at that time. She was like, wait, I remember HeHealth, that penis app. So she download the app. She go and tell the partner, hey, can we check on this? She was like really convincing the guy. And then they check and it says it's herpes. And she completely freaked out, grabbed the partner to the hospital. Sadly, it was confirmed as herpes. Herpes is a lifelong viral infection. You cannot cure it. You can only control it. And she was so pissed that I prepare for my whole life for my sexual intercourse for the first time. Now I'm infected with the herpes. And how am I going to face the world? And she was saying, if I knew about HeHealth before, I could have done it as a part of my foreplay. I was like, wow, youngsters nowadays are very different from my time. But she was saying, I could have take the phone, take some pictures without he's not knowing it, And if I knew something, I don't need to know for sure, but if we flag something serious, I could have used a condom at that time. After that, we heard so many stories. Girls are saying we use this as a conversation starter, rather than me jump in with suddenly say, hey, can we test the STI? And we know youngsters in dating apps nowadays, they exchange their penis pictures, vaginal pictures. They were saying we use this as a conversation starter. And that's a very powerful statement, So we giving them the power to initiate that conversation and giving them the power to protect themselves. This is true female empowerment. And my co-founder Mailing is very passionate about it. And then, of course, 1 month ago, we launched, its name is Calmara. Again, if you see any visual symptoms, it gives you a second pair of eyes to have a look at it and tell whether it's something you should be worried or not. Simple as that. Because sexual health is so personal, you cannot go and ask your mom, hey, can you have a look at it? We want to be that second pair of eyes to help youngsters guide them through. Again, Otis is also coming into Calmara, guide them through, Not only that we are saying, hey, this looks like something suspicious in that picture. This is how you're going to manage, My AI can even tell you what questions you need to put into the guy so that they can have that conversation. So these are very powerful things you are bringing into the youngsters, which the government should, around the world, should actually facilitate the sexual health education, but which most of the places doesn't do. Religion is not really supporting in certain places, but we are bringing these technologies for youngsters to actually use it so that they feel empowered,
Yeah. Is there any plan in place, Yudara, for that or maybe Otis is already doing this, but just for the more education piece, like educating users, going external, trying to educate others? Is there any plan in place there?
100%. I think that is the most important part. And a lot of people misinterpret what we do. If you look at STIs, there's massive portion of STIs are asymptomatic. That means you might not know it until you test it. So, but if you think about it, just saying that there's asymptomatic ones, people will not care. You always have to find a trigger point so that once you trigger it, then you tell, then people are interested. Let me give you an example. People come to us because, as I said, there's no entry barrier. It's so easy. And then for trigger points, more than 50% of the people come and use our app is no STIs at all. Or at least there's no visually recognizable STIs. But as I said, there's a trigger point. That is usually you go out on a Saturday, have the best night ever, you had unprotected sex, next day you freak out. On the moment you are fine, but next day you're freaking out. So they come to us and say, they check with the AI, there's nothing abnormal at this point, but we quickly jump in. My AI jump in and say, look, even though we don't see nothing, there are a lot of undetected asymptomatic STIs. Not only that, we give them even the plan to do the STI testing. A lot of people, I say, these are complicated matters. If you do within the window period and you get a negative, doesn't mean anything. So, but you need to do at the right time, then only people can do. So we guide them, we say, look, now that you are here, you might be still exposed. And then these are the tests you need to do. Not only that, let me ask you a question. Do you know there are so-called the emergency contraceptive equivalent for STIs? That means you can take a pill the day after you had sex, and it can prevent you getting STI even if you had exposure. Do you know?
Oh,
No,
Exactly.
I wasn't aware of that.
no.
Exactly. The technology is there. You can actually, even if you have sex with a HIV positive patient without protection, you can take that tablet. It'll almost prevent you getting HIV, 95%
Wow.
and more. Same as the emergency contraceptive, we call morning after pill. And
Oh my
now what we
gosh.
do is we telling the users and say, hey, not only that, maybe you can within the window, you can take this tablet. And people are like, oh, I didn't know that, and they rush to the clinic to get the tablet. That's the effect we make. Because last time there was no way people can make it to the doctor for these small things. And doctors are too busy also telling these things. But now there's no barrier to the access. People come to us so easily, and we can also easily guide them through what they need to do and so on and so forth. Yes, education is definitely one of the biggest parts we are focusing on.
With this whole process, what's been kind of have you run into any significant sticking points in getting people to adopt the app, or just in building the app? I'd be curious to hear about some of the problems as well.
Yeah. Luckily, I was backed, and there are a lot of scientists in big universities in US who's working with us, and that's really good because people really see the value. But that's on the academia side. But of course, in the public side, there are still a lot of concerns about, like, for example, like sending a penis picture to app is not something easy for most of the people. But we make it in a way that we communicate this. Once they go into the process, they understand. For example, we believe in anonymization is one of the most important part. We are not saying we collect your data and we are protecting it. We don't collect in the first place. That means we don't collect any personal identifier data like name, social security number, address, nothing, phone number, nothing. We don't collect in the first place. Internally, we generate a number to recognize you who you are, or if you come back later, then we know exactly the same person. But that's it. We don't label any of things which is sensitive, which is penis picture, with your personal data at all. That's the first step. Second step, we still follow the best practices of the data protection, so on and so forth. But again, these are finer print things, right? We don't put everything in the surface and say, look, we say, of course, your data is protected, but if you don't see it, people might still have some, and of course, it can be still a cultural taboo to a lot of things. And especially when we launched Calmara, this is a controversial in some ways because it's not you using it, your partner is using it with your consent. But I think with the COVID, clearly things have changed. Last time, before the COVID, you can say it's my right to wear a mask or not. That's it. If I don't want to wear, it's my right, which is accepted well. But after COVID, people realize it's not so. If I'm talking to you, you cannot just say it's your right because I have a risk of exposing. I have the right to ask you to wear a mask. This was a new concept came during the COVID. The idea has changed. If you apply the same thing into the sexual health, what we are doing is we're giving the girls the power to ask, if you are having sex with me, I have the right for you to ask to wear a condom. That's it. So these concepts are new. It's kind of like, oh, wait, can they do it? Of course they can do it. But these things were never challenged in the society. We are bringing these concepts which is actually good for the community, good for the society, good for the world. Because STIs, at the end of the day, infectious diseases, it has to be two people, right? I cannot just get it from one person. So we are empowering people to make the right choices.
Awesome.
Yeah, that's powerful.
So
Go ahead.
Oh, go ahead, Jake.
No, go for it. You're good.
My question.
It really does sound very empowering to females, which is incredible. I think that's powerful.
I think as a society, it empowers both. So again, in a relationship, for relationship to thrive, there's two sides, right? So, and then if one person can prevent it getting, and then that can escalate into a downward spiral, which as a society, the numbers will go. And then now what happens is many people can have STI and they can continue to have sex. That's why the STIs are going. If you crack one side well, actually the other side benefits the most because overall the numbers are coming down. Yes.
So where do you see HeHealth going in the future? Now that you've kind of built out the base product, you have Calamara. Is there anything else on the horizon right now, or is it for now just kind of focused on getting those products widely adopted?
No, Spencer, we are very excited about the next few months and years. Clearly, we are making products. Calamara is at the moment is for females, for their partner, but how about themselves? They have visually recognizable symptoms. We are actually building products, training the models right now. But the most important thing, or the model which comes before that, is to complete the ecosystem. We think there are a few important ones, which is male, female, and of course the LGBTQ community, which is very important. So we are building some products specifically for LGBTQ community, and then after that we'll bring the tools to the female side, which will complete the triangle, which all the sexual health requirements in the society will be met through AI. That's our next few steps, and then of course beyond that, we looking into applying into some of the other diseases also.
That's awesome. Yeah.
And
So
what are you?
Go ahead.
Sorry, we have so many questions. No, go for it, Spencer.
You got it. I had the last one. So,
without giving away any proprietary methods, like when someone comes in, they send in their pictures. What's happening on the back end? How are you training those models? What is that? Technologically look like?
Yeah, I'll touch on the training part. Of course, we need to have a lot of so-called label data to train the model. It's same as when a medical student is going through the training to become a doctor. So our senior doctors usually go bring them and say, hey, this is, for example, syphilis case. Medical students examine and then remember, go study, and then they will see another one, and then they will remember so-called pattern recognition. Of course, computer do much better. We have trained with thousands of we are quite proud to say we are, as far as we know, the largest annotated sensitive data holder in the world. All the penis, anus, and vagina related data annotated. That means data itself is not valuable as much as before you annotate it. So we put doctors to label them, annotate them, and we have large data set. We use them to train the models. And then once you train the model, when you submit the picture, model try to literally matchmake and say, hey, is this similar? And then comes to the most closest one and say, okay, I think this is syphilis. And then give the data. That's the basic part. Now, as I said, with LLM, there are so many other things it can get into consideration, like how old are you? When do you had sex? And then are you in the window period? When is the time you are supposed to have rash? Are you within that time period? And then look at the rash and combine all these things and then really works like a doctor. So that's the beauty of it. It's not vision recognition anymore. It's what you call multimodal, multidimensional detections. So it can literally process all this information and tell you what you have and guide you through.
That's awesome. Do you have data on like the accuracy of the predictions? Have you been able to collect on that?
Of course. We just got accepted our first paper, which talks about peer-reviewed paper, talks about our basic model, which is the fun part is at that time, the common things like HPV, we have about 94% accuracy, and not so common things like penile cancer, it can go as low as 65%. And it's always say common things are better, and then not so common things are not so good. But by the time our research paper is accepted, our model is already updated to the newer version, which have much better accuracies. Now, all the detection parameters are hitting close to 90 or more than 90. That's the thing. First paper technology has grown. I'm sure you have realized ChatGPT, you release one model and then next day there's another one coming and then everybody's saying, oh, I'm better than next one, the last one, and I'm better than, and how fast things we are not that fast, but within the 1 year we release another model, which is very good. And then not only that, we just released another research work which we use synthetic data to augment the accuracies. With this, we haven't applied it into our model fully. We should be able to hit 99% in certain disease parameters very soon.
That's incredible.
Yeah.
Wow. Yes, yeah. And that answered my next question, which was, have you used any synthetic data in training? Yeah, that's really impressive. Like that's, I mean, to me, a slightly naive listener, and I'm not super deep in the medical world, but from my understanding, that's a pretty good success rate.
It is. It
even
is.
even for a doctor.
It is. It is. I
Yeah.
mean, again, the part where we think is the movies. They still need to be a lot of testing on the ground and so on and so forth. And then some people ask, like, how come you still release it to the public? I said, look, it's better than what we have, which is Google.
Yeah.
It's way better than Google. But is it close to doctor? Very close. But is it better than doctor? Not really. And we are not waiting until it becomes better than doctor to release it to the public. Even OpenAI, Google, now they're releasing models super close and then learn on the go. But what we do, as I said, as a physician, first principle is do no harm. That's why we explain clearly what we do and guide them through. We give them information, we guide them through. So that's how we think. So we manage the risk, but I think at the end of the day, the future looks super bright. So we are very excited.
Yeah, that's super exciting. Has there been any pushback? Because I know I'm in the accounting industry, and there has been so much talk and so much panic that AI is going to come in and take all the accounting jobs, which I don't think that's the case. But I'm curious in the medical industry if you've seen that. Have you gotten pushback from doctors or nurses or anyone in the medical field on this technology?
Jacob, if you look at me as a physician, I would say clearly, out of all the industries, the most protected ones are like things like medical or legal. So people have the most resistance to adopt technology. They say, no, they cannot do my job. I'm so special. I had to learn 10 years to be in this position. So they have a lot of pride and so much attachment to what they do. So if you think that the accounting have resistance, you have no idea how the resistance in medical.
Sure.
So most of my colleagues will speak against me because they are scared, which is natural. We spent 10 years of my life to reach here. And now you are saying my AI is better than me. Of course, people get disturbed,
Yeah.
So and if you look at some of the media articles talk about it, there's a lot of negative parts they talk about, which is naturally expected because we create such a disruption in the industry, which is the disturbance is expected. So, but with the time, people will realize this is in the right direction. It's helping people, It's not only about your job. So, yeah, I strongly believe this is the way to go. But humans need to be in the loop. So I don't think there'll be replacement, but doctors have to be better with the AI.
It's been interesting how often we've heard basically exactly that with almost every founder that we have interviewed, that everyone still believes having a human, regardless of what you're applying AI to, that everyone still believes having a human in the loop at some point is necessary and very valuable. The way I see it is AI can, it's a brand new supporting tool where, if you're a doctor and someone comes in with a report from HeHealth of, some potential problems they might be having already, if you can trust those diagnoses, like you have a higher starting point, and you have some ideas to pursue right away. And so to me, it seems like a no-brainer that you should adopt it. But
Yeah,
I can totally see where you're coming from, why doctors can be
yeah.
a little bit
Spencer,
hesitant.
what you explain is a very well documented scientific situation in statistics, what you call pre-test probability. So before the test, even you know so high that the test is going to be positive. So then, of course, whatever the test you do, your accuracy rate will be super good, like 99.9, because your starting point is already very good. So these are very well documented things, what you call pre-test probability. That's exactly what we do. We increase the pre-test probability, the screening part, so that the process is cheaper. Because in science also, there's another thing called the higher the accuracy rates you want to do, so the tests are either expensive or they are more invasive, like it costs like a lot of blood drawing and so on and so forth. But if you have a very high pre-test probability, you can even go with the not so accurate test and you can still get really good results because you're already starting with it's like you're running a race, but some guy starts halfway through, then start running from there. That's exactly what we do with technology.
Yeah. Well, I just love. It seems like you've just built out this amazing model that is going to open up so many avenues into other realms too. Like I can't wait to see this applied to not just sexual health, applied to, so many people. I was just talking to a friend who had to go in and get a physical, and he was making jokes about, yeah, I have to go in and get a physical, and they always ask you when you're in there, do you have questions? Is there anything you're wondering about? And you're like, no, I'm okay. Even though I feel like everyone does, right? Like, but you don't want to be like, yeah, I have this weird mole on my back. Can you take a look at it? Like, people are just uncomfortable with that. So, like, thinking of, like, I've been trying to keep some tabs on just innovation in the medical realm. And I've seen things like training AI to help recognize different cancers. And I just saw this article that it recognized, I can't remember which cancer it was, but it recognized that there was actually 3 different types within one that we thought it was one. It's actually 3. And I think this is a whole new like health awakening, and we're just on the cusp of it. It's incredible.
So next 5 years, speaking more broadly now about AI, in the next 5 years or so, where do you see AI going? What is your vision?
I mean, this is an interesting question. To be honest, the technology is growing so fast to a point that we cannot predict where it'll end up, but I think it'll able to do quite a lot of good things for developing countries because they will adopt it faster. They have a lower entry point already. They will benefit most. Even for the developed countries, I think there will be a lot of changes. But honestly, to predict how much it's going to change, because if you look at all the big tech people are asking, like, when is the AGI, artificial general intelligence, coming? So, and then we can say once the AGI hits, doctors will have really tough time because AI will be definitely better than you. So yeah, these are the things. But rather than predicting, we are closely observing, making that change happen in the society in the first place, and then enjoying the time. It's an exciting time to live.
It is. It's been I feel like it's just kind of revitalized a lot of my interests in life, and it's been amazing. I forgot my question. Jake, do you have?
Yeah, I'm curious, Yudara, the medical industry. I'm in the accounting industry, and I work a lot with early stage life science companies, and I know there is just so much regulation in place with an industry like healthcare, particularly with new products like HeHealth or anything else. How do you do you anticipate issues with regulations? Have you had regulatory agencies come in? Is that a problem?
Definitely not a problem. I think regulation is something very important in healthcare, and there has to be some kind of looked after. I think that's the right way. But have you had problems? Of course, again, it's a spectrum, right? Some regulators might think of more strict way, and some people might have more pro innovation way. So, I mean, I'm referring to different countries. And clearly, we were based in mostly US. Europe, we have much more stronger data privacy, GDPR. So, 1 or 2 countries in Europe side felt there were things that we might need to work on. So, but we said, look, if that's the case, we don't have the bandwidth to definitely cover all the countries who are US based. On the US side, which is more proactive on the innovation, and the FDA regulations are much more robust. So we are positioning ourselves as screening, not a medical device. So we are in the wellness category. And even if you look at the Apple Watch, they put a lot of things as in the wellness category. They measure heart rate and say, this is for your information. It's not for hospital use. So that's where we are. But doesn't mean that we want to go all the way in as a diagnostic test, like a blood test, but a digital one in the future. So this is work in progress. Yeah.
If you were giving advice to someone entering the AI space, whether it be in healthcare or whatever in other industry, what would be kind of the advice you'd give them?
That's a good question. I will start like this. Rather than starting with advice, I think you must always ask why you are trying to do what you're trying to do. So there has to be a mission part, like as I said, me as a physician creating completely new areas of innovation. If there's nothing precedents that I can look at and say, oh, previous guys did like this, so I will follow. But we don't have. But a lot of people ask, how do you innovate? Me as a physician, I have the first principles, a Hippocratic oath saying that, we don't do harm. we do only good things. So that drives me on, say, what I need to do. So in that, taking that same steps into the other areas, I think you need to ask why you're doing it, and then you need to ask how you're going to do it in a safer way, and how you're going to make sure that your users, intended users, benefit from whatever you think you're trying to do. So you need to ask these questions really. Also, it's important because innovation is not easy. So otherwise, if you don't get these things right, if you are not so passionate, then you might drop, you might not be successful in the middle, because you have to go through so much pain. And then if you're not so sure about what you're supposed to do, a lot of people might drop. So I think rather than giving advice, you must ask these questions before you even start.
I like that. I like that a lot. Yeah, because you see too often people just kind of diving in blind, and I think that's a recipe for weak companies. And so I like what you said about, like, first asking yourself, like, do I have a passion about this? And second, like, will this actually help the users I'm trying to help?
Yep.
Right.
I will close it with a quote. Jason Huan, the NVIDIA CEO, said a few months back in Stanford graduation. Instead of a lot of people think sweet words, he said, "I hope you suffer." That's exactly what he said. No, I'm no joke. And what it means is this will differentiate sound from noise. This will differentiate good from bad. People who really can go through that suffering and stand still are the ones who are going to make a big difference.
I like that.
That's powerful. Yeah, I completely agree. Thank you, Yudara. And
No
thank you for
problem.
coming on the show.
It's a pleasure,
Yeah.
guys.
Yeah, thank you.
This was awesome.
So exciting. I can't wait to see where this goes. Yudara, if our listeners want to follow you, follow HeHealth, what's the best way to do that as far as social media goes, other platforms?
Yeah. I think the best way is LinkedIn, and they can search my name, HeHealth or Kalmara, or my name, Yudara Kularathne. They should be quite easily able to find.
Awesome. Thank you so much, Yudara. This was awesome. And yeah, thanks for coming on the show.
Yeah, it's a pleasure.